Hello there, this is Famedix Help Beat Diabetes Care. Diabetes care in the community is what we do at Famedix. Today we're going to be discussing a topic that is of concern to many diabetic patients, and that topic is hypoglycemia or hypoglycemia, depending on how you want to pronounce it. Hypoglycemia occurs when blood glucose falls below 4 or below 72, depending on the monitor you are using. If you're using the AccuCheck monitor, then you wouldn't want your blood glucose to fall below 72. But if you're using the fine test monitor on the on-call monitor, which measures in millimoles, you won't want it to fall below 4. Any reading below 4 will count as low blood sugar. Whilst many of us think of diabetes as being a problem of high blood sugar levels, the medication some of us use, some diabetic patients use, can also cause their sugar levels to go too low, and this can be dangerous. What is hypoglycemia? Hypoglycemia occurs when the level of glucose present in the blood falls below a set point, below 4 or below 72, as I said earlier, depending on the monitor you are using. Being aware of the early signs of hypoglycemia will allow you to treat your low blood glucose levels quickly in order to bring them back into normal range. It is also recommended to make close friends and family aware of the signs of hypoglycemia in case you fail to recognize the symptoms. The main symptoms associated with hypoglycemia are sweating, fatigue, feeling dizzy. Symptoms of hypoglycemia can include being pale, feeling weak, feeling hungry, a higher heart rate than usual, so you get your heart rate beating quite quickly, blurred vision, confusion, convulsions, loss of consciousness, and in extreme cases, coma. So you see that even though the early signs could be mild and you could miss it, it could well hatchet up to very severe symptoms, which could ultimately lead to death. I'll go through the symptoms again. Symptoms of hypoglycemia include sweating, profuse sweating, fatigue, you feel tired and exhausted, you feel dizzy. Symptoms of glycemia can also include being pale. You won't often see that in dark-skinned people like myself, but being pale, feeling weak, feeling hungry, a higher heart rate than usual, blurred vision, confusion, convulsions, loss of consciousness, and in extreme cases, coma. What is at risk, who is at risk of hypos? The short form of hypoglycemia is hypos. Whilst low blood sugar can happen to anyone, even non-diabetics, if you haven't eaten for a long time, you are hungry, your blood sugar is dropped, your body needs some food, you could feel those symptoms, the early symptoms as we mentioned earlier. But we're concerned about the diabetic patient here. So whilst low blood sugar can happen to anyone, dangerous low blood sugar levels can occur in people who take the following medication. So beware, if you're a diabetic patient and you're on one of the following medication, you need to know the symptoms of hypoglycemia. Insulin. If you're on insulin, you need to know the symptoms. If you're on glibenclamide, popularly known as Downhill or Clamide, if you're on gliclazide, if you're on glimepiride, popularly known as Amoril, and a few other diabetic medications. If you're not sure whether your diabetes medication can cause hypos, read the patient leaflets in the pack. Many of us don't do that. So I would say either speak with your doctor or ask your pharmacist. It is important to know whether your diabetes medication puts you at risk